high. So in that case, you need to look for the blocking of ACE4 receptor. So this is the allergic reaction type. And this is the main topic in our discussion for today. 4 drugs. So if I ask you, then this section I will make the many questions, because this is whenever you make the treatment for anyone, or whenever you want to look for the medicine for problem, so you need to look for the solution like this. So this is the point always you need to keep in your mind. There is, I mentioned, ACE1 receptor bone co
type 3 টা আরেকবার একটু বলেন স্যার।
Huh?
Type 3 টা আরেকবার স্যার।
Type 3 is T cell and B cell. So type 3 is T cell, B cell, means white blood cell. You need to keep in your mind, white blood cell will be high. Total white blood cell in the patient will be high. If your drug has a strong interaction, side effect, overdose in your body, when you look the blood report of the patient, you will see white blood cell will be high, means T and B cell will be high. So you need to look for the blocking of ACE3 receptor. Which drugs in the market available ACE3 receptor? And then, as I told you, natural we have many, homeopathy we have many, and also in the market have many drugs can block this system. You need to look for cellular immunoresponse system. This is called natural killer cell, NK cell. NK cell are responsible for this. NK cell are also for white blood cell. So this is why type 3 and type 4 is very difficult to make the treatment for the patient. Is not so easy, because there is a complexity, and this is full system of white blood cell, and which cell are responsible for type 4 and which cell are responsible for type 3. It is not easy to recognize, it is not easy to understand. So this is why when doctor prescribing, they are doing mistake all the time, only this section. This is the treatment, and both of the so angiotensin drug, you know this, you will find many angiotensin drug in the market, a group of angiotensin group, but it's quite impossible to find which drug is for which interaction. It's difficult. So this is the mechanism. This 4 mechanism, immunoglobulin, hypersensitivity mechanism, you always need to look when you for the patient when you want to make the treatment. And these are the common picture in Bangladesh, in the entire world. These 4 types interaction are common picture almost all patients in the entire world. And it is easy to type 1 and type 2 are easy to diagnose, but it's not possible to diagnose type 3 and type 4, because there is a 3 many white blood cell have interaction, eosinophil, basophil, and then neutrophil, many drugs. Then you need to go all through this. When you go to all through details, then you need to look for the problem of the patient, then maybe you can find the drugs. If you do make selection the drug after analyzing like this, maybe you can cure the patient instantly. And there is a, I have tell you a receptor, I tell you ACE1 as a bone constriction, vascular permeability, smooth muscle contraction, means these are the symptoms. H2 gastric acid secretion, as I tell you, cardiac chronotrophy and ionotrophy. Do you know cardiac chronotrophy?
এখন সময় রাত
You are sitting on the chair, suddenly you have a pain on the left side of the heart, and then doctor and you are thinking, oh my god, I have a heart attack. But this is not the heart attack. Heart attack means if you have acidity, if your stomach has a stomach secret the acid, you can have a heart attack. This is called cardiac chronotrophy. You are sitting on the chair, suddenly you have heart attack has come. This is called from acidity. So in that case, if you prescribe the medicine, gastric, if you prescribe the medicine for aspirin or blood thinner, you will do the great mistake. So patient can be died. So you need to look for acidity. In that case, you need to look for the solution for this heart attack. You need to look for the solution, antacid tablet, anti-acidity, gastric you are looking for, like this. You are running on the road. Then pain, backside pain is coming, means you have a heart problem, means your cholesterol is high, and you are sitting ideal, you have a suddenly heart attack is come, means it is comes from the acidity, comes from the gastric ACE2 receptor. ACE3 inhibition of histamine formation and release. ACE3, as I tell you, white blood cell will be high. When white blood cell will be high, histamine or you see histamine is mainly will be high. Histamine will show ACE+++, and so this is also the treatment. So you need to look for the histamine receptor blocking for white blood cell, not which white blood cell are responsible. Eosinophil, basophil, neutrophil, many white blood cell. I cannot say all the name. Natural killer cell, T cell, B cell, etc. You need to look, and it is the ACE3 is the critical part. People are still confused in the entire world to make the treatment on this section, ACE3 and ACE4. So if you want to do the PhD, you want to do the research under my supervision, then I will tell you, you can work on ACE3 or ACE4. Then you will find the solution. What will happen? Okay.
Sir,
Huh?
sir, how acidity relates to heart attack, sir?
Huh? Acidity means your stomach will secrete the acid and your heart will be blocked. Means you will not be able to breathe. Breathing will stop. And pain will come. Serious pain will come. This comes from the acidity. It is not from the blood cholesterol.
Sir,
So
what are the
what we-
relation to secretion acid and blocking the heart?
Yes. So if acid stomach is secrete the acid, H2 receptor means if you have a chest burning, acidity, gastric, if you feel like this, you can also have a heart attack. But then you need to understand the heart attack is come from the cholesterol or heart attack comes from the acidity. So if you understand, oh, he has a heart problem, we need to go to the heart doctor. But in that case, if you go to the heart specialist, he will prescribe the medicine only for blood thinner. Avostatin, many they will prescribe. Aspirin, blood thinner, they will look for blood thinner and they will give many blood thinner, but your problem will not like this. Then they will say you need to wear the ring, you need to set pacemaker, but finally you will die. In that case, you need to go to the gastro-liver hospital. Then they will diagnose. They will know it comes from the heart attack, from the H2 receptor. Okay. So this is the same. This is the key point. And the hypersensitivity, the same type 1. What symptom you will see? You need to look for. There is, I have shown the some mechanism as a basophil and lymphocyte. So Ig, histamine, H1 receptor is secret mainly. So you need to look for the lymphocyte. It mainly lymphocyte comes from the after your tongue, both sides of the. This is called tonsil. Both of the tonsil are lymphocyte. They secrete mainly white blood cell. So if you have a and the white blood cell they secrete because white blood cell works against the virus and bacteria. But if your white blood cell fail to fight against the virus and bacteria, then your inside the body will be white blood cell will be very high. And white blood cell will be very high and histamine will be huge secret in your body and blood will be vasodilated. Vasodilated means blood, vaso means blood, dilation means blood will be what is called the blood thinner. Blood will be shape change, blood shape will be changed and blood will not be the disc shape. So blood will be like a flood or something different kinds of shape and then blood will not flow. So blood will not take the oxygen from your lung and bring to the tissue. So you can have a heart attack. Then you feel, oh my God, I have a heart attack. This is a very important toxicity part. This is the section you need to keep in your mind. And this is it's not important to know because it's not important to interleukin 4 receptor, interleukin 5 cytokine. So these are the whole white blood cell, but I want to give you MHC. So major histocompatibility complex. You know this. So plasma transfusion. So few days when during last year or this year we know the news, very common news. So if you have a coronavirus, so you can transplant your plasma. So you can take the plasma from someone and put inside your body. But here is in that case, you need to keep one point strongly keep in your mind. The major histocompatibility complex means his plasma need to match with your plasma at least 90%. Matching. If you do not have matching, and if you take this blood plasma from someone, you will die instantly. Within 1 and 2 hours, you will die, because it interact with your plasma and make the complex, and aggregation will come, and your food system will block. Aggregated food will be blocked within 5 minutes. Will happen like this. So this is why when you take the plasma from someone, they will consider MHC, major histocompatibility complex. They will measure like this. The same thing I told you before. This is the killer cell, NK, natural killer cell, and T cell. And T cell both are cytotoxic, and how this is work. So when you see the macrophage is which blood cell are responsible for macrophage? Basophil or eosinophil? Did you see the blood shape, the white blood cell shape? Which white blood cell? Basophil, eosinophil?
Basophil, sir, basophil.
Basophil, exactly. And basophil will be cytotoxic, and it will secrete the histamine, and your blood will be vasodilation. Good, very good. This is called cytotoxic. Cyto means cell, a toxic means toxic. Cell means white blood cell will be toxicated. This is called cytotoxic. Interaction with overdoses of medicine. This is the point. And this section I also simplify in here. The same. I told you the last is 4. 4 is contact dermatitis. You need to see the clinical. So first, for example, IgE means type 1. Type 1. IgE, the urticaria, systemic anaphylaxis. So you will see the skin will be rashes, and the lips will be, one eye will be the inflamed, face will be highly inflamed. This is called. And IgM and IgG, the hemolytic anemia. So many ladies in Bangladesh, ladies who take the hemolytic, means your anemia, means your blood will be destroyed daily. So ladies does not know in Bangladesh they have a blood shortage because they are taking huge medicine. If you take them, ladies are already, they have a blood shortage. If they take the medicine, so medicine also IgM and IgG, both immunoglobulin interact and destroy the blood. And the blood shortage is also one of the cause to take the medicine for a long time. See, if ladies are taking medicine for a long time, and if they have a medicine interaction like sulfur drug, aspirin, as I show you before in the first lecture, this type of medicine, if they take for a long time, they will have an anemia. Or any medicine, if they take for a long time, they must have an anemia, because these are work hemolytic anemia, means your blood will destroy and out, no new blood will produce. And IgG, the serum sickness. So your serum will change. Your serum will be concentrated, or blood pH will change like this, IgG. And TD, T cells, contact dermatitis. So you will have a skin disease, serious skin disease, your skin will damage, and skin with the white so skin will have a, what is called this, damage. Bangla call kisi ঘা, স্কিনের উপরে বড় বড় ঘা হবে, এবং সেখান থেকে কি বলে রস বাইর হবে. It secretes the glue, some type of glue, transparent glue secret from the skin. When someone will touch your skin, so he will also have the same problem. This is called T cell, and this is why people does not know why this is happened. It's still there. So T cell, the type 4 reaction people are doing a lot. People are doing research a lot in the entire, maybe million of people are doing research only this section, T cell. So a small molecule, I give some example. So this is the molecular weight. This is a small molecule, and the big molecule means more than this, like this. So mast cell attached to the mast cell. So IgE mainly attached to the mast cell. It's a simple same topic I told you, and you'll see the symptom: hay fever, asthma, eczema, bee sting, food allergy, etc. like this. Risk factor, so frequent exposure to the drugs, large dose of the drug given by the injection rather than pill. For example, you take the drug, toxicity, you take drug. So I can wash your stomach. It is easy for me. But if you take the toxic through the injection, you must die. I will not say the name of the hospital in Bangladesh, but 5 doctors in a famous hospital in Bangladesh told me that they kill many people because of this injection. Means it is quite impossible to remove the toxicity from your blood. It is easy to remove the toxicity from your stomach. You take the medicine, wrong medicine, I can wash out you. But if you throw the injected, if you take the injection, it is very dangerous for you. And if you one time mistake, you must die. There is no option for you to alive. So before taking any injection, be careful, serious careful. You need to do this. So don't take vaccine. Vaccine is a serious poison. Family tendency to develop allergy. Okay, if your father have a allergy, you can also have a allergy, but this is not minor issue. Reaction, so it's a rash, you'll see fever, muscle and joint ashes, lymph node swelling, inflammation of the kidney, anaphylactic shock, like this type of happen, like this. And this is the same I show, T cell, separately I have shown in here how this will happen. B cell, I told you, T cell and B cell is a very natural killer cell. And here is I show the mechanism of allergy response. So there is I keep in blue color. Did you see on the blue color on the skin, IG like? So blue color is a, here is I have shown sulfur. So as I told you, sulfur drug is highly interact in our system and highly allergic, sulfur drug. So when I will make the question, so who is drug? Sulfur drug. And then if I ask you the question, can you write the functional group? Then you need to write SS, S.S-S. This I block in here. This point you need to keep in your mind. No need to memorize the entire system. Just sulfur drug means sulfur. So when I see the problem of the patient, so in homeopathy, it is called like, dissolve like. When I see they have a huge interaction with drug, then I apply the sulfur to the patient. In the homeopathy, you will find the sulfur, direct sulfur. When I apply that, when I prescribe the sulfur to the patient, I see their problem is completely solved and permanently solved. Like this, galactose, blood transfusion, antibody mediated cytotoxicity, like this, as a galactose, lipid or protein. So if you like, direct sugar is not good, but if you take the molasses, it is good for your health. And if you take sugar, malted sugar, this sugar is like one kind of glue. So sugar is like adhesive. So if you take sugar with water, this is good. But if you take direct sugar glue like this, so it will form the aggregation with your lipid, and it also can be the toxicity. So glue, sugar is work as the adhesive, one kind of like this. And this is happen when the person will have a ABO blood group, only for this person. So blood group is also important for you to know the which drug you will have a interaction, or which drug will be toxic for you. So you will you can understand, or you can calculate this information from the blood types. And there is I give some example. IgG, the RS factor. So you know RS factor, baby born, RS minor, mother first time. So second time can have RS from the first pregnancy. Baby placenta and baby kills its own RBCS. So for example, so IgG, if your drug, so type 3, type 2, so it can hemolyze the blood system. So how it hemolyzes, mean how you will have a blood damage. So if you have an interact, so many kids do not have a blood shortage because they don't know the medicine they apply. This medicine can also hemolyze the blood, can damage the blood and out the blood. So this is the method how they will damage the blood for baby and also for mother. So this is the topic. So your main topic is like this. This section is your main topic. This is the main allergic reaction type. This is the main part. And immunoglobulin, this is the main part of your topic. This is the main part of this today's topic. So you need to keep in your mind, because this I will not supply to you. When I will make you the question, I will not supply this information. This information always you need to save in your mind, so that you can memorize and write the answer, the questions. Do you have any question from anyone? So who is the class? So CR, who is CR? CR is, when I see the CR.
Sir, Muzammil Hussain, sir.
মোজাম্মেল শোনো মোজাম্মেল কালকে থাকি তো রোজা তাই না?
জি স্যার।
হ্যাঁ যাবে না, তোমার টাইম চেঞ্জ করতে হবে।
জি স্যার।
এখন অন্যরা আমাকে একটা আমি তো 4টা কোর্স নেই, একটা কোর্স দিছে 11টা থেকে 12টা, একজন দিচ্ছে 3টা। তা 11টা তোমার হলো, যেহেতু দুপুরবেলা কোনো খাওয়া দাওয়া নাই, কিছু নাই, তোমরা এক কাজ করো, 12টার পরে 12টা থেকে 3টার মধ্যে ক্লাসগুলো দিয়ে দাও।
ঠিক আছে স্যার, ঠিক আছে স্যার, আপনার জানাবো স্যার।
হ্যাঁ, তোমরা টাইম ঠিক করো। এক গ্রুপ দিয়েছে হলো 11টা থেকে 12টা।
জি স্যার। আর গ্রুপ স্যার 3টা থেকে 4টা।
আর এক গ্রুপ দিয়েছে 3টা। তা তোমাদের টাইম হবে between 1 and 3 within this time.
জি স্যার।
You need to send me the time, then I will compact all 3 time together and send to you.
Okay sir.
You need to discuss with all your friends, then you send me the message. Okay.
Okay sir.
Good night for today, and we will not have any class at night during the Ramadan. Okay. Good night for all.
Assalamu alaikum, sir.